The House Committee on Education will come to order. Will the clerk please take attendance?
Chair Colazar.
Here.
Representatives Churches.
Present.
Shannon.
Present.
Weiss.
Here.
Glanville.
Here.
Conlon.
Here.
Edwards.
Here.
Wagella.
Here.
Breen.
Here.
Markkinen. Paquette.
Here.
Wenzel.
Here.
Johnson.
Here.
Mr. Chair, you have 12 members present. You have a quorum.
Thank you. Representative Wagella moves to approve the minutes of the March 11th committee without objection, so ordered. Today we will be talking about 5 bills from a school safety package. Because substitutes have just been distributed to the committee, we will not be adopting the substitutes at this time. I want to give members adequate time to look through them. But if those who are testifying wish to speak to those subs, you are more than welcome to do so. So with that, I would like to welcome up Reps Breen, Meerman, DeBoer. Do we still have Rep Young, or is she voting in the other committee? I think Rep Young will be joining us shortly once she gets here, and I believe Rep Puri is testifying in another committee. So those reps can come on up. And from there, whoever would like to go first can get us kicked off.
Thank you, Chair Colazar. I apologize for the tardiness. My son decided, of course, as we were walking out the door that he had a stomach ache. So it was very convenient on his part, but here we are. Thank you. We are here to testify on some of the work that is happening as a result of the School Safety Task Force. We started at 8 members. Rep Meerman and I believe are the last ones standing. I have testimony not only in my bill, but to others as well as details of forthcoming substitutes on all the bills. After we're done here, I have some people who would like to testify, a school security expert, a psychologist from Oxford, and a social worker from Southgate. So we're here to talk about what we can do as legislators to improve the safety of our kids in schools, not just from external dangers, but also help to identify and support those children who are thinking about hurting themselves. And just on a personal note, I think, honestly, there are a lot of parents up there. The worst question I've ever had to answer was my little girl a few years ago when she said, "Mom, what do I do if my teacher tells me to run and I can't find Elliot," her little brother? No parent ever wants to answer that question. So I think we can agree, all of us, no matter what side of the aisle you sit on, that our kids have a fundamental right to a safe and respectful learning environment. And we know now that when our kids are not physically or mentally secure, they cannot learn academically. We also know that violence is not limited to gun violence. It's not limited to schools. It's a multifaceted problem, and it will require multifaceted solutions. And we wished to, as a task force together, find solutions that would mitigate and prevent violence overall, ensure schools are able to address and recover from violence should it arise. And we know that promoting mental wellness and protecting mental health is paramount. Every district in the state is unique and with varying needs. Some schools do not have very basic school hardening features. Others are implementing some of the newest technology. We have areas of the state where the nearest police station is 45 minutes away. Places like this are going to need unique approaches to school safety. The needs of rural areas are frequently different from those of urban and suburban communities. And because of the varying needs of all the school districts, it's impossible almost to find a one-size-fits-all approach to ensuring the mental and physical safety of Michigan's children. During the course of our task force meetings, we ultimately arrived on 6 policy areas that most ideas and needs and even these bills before you today will fit inside. And those areas are mental health. That includes affordability, accessibility, and what can be delivered ostensibly broadly to students, and identifying students that need the most targeted assistance. Physical security, which includes structural and security improvements. Data, processes, and procedures. Staffing and personnel. Firearms and criminal justice. And education and public service information, such as the integration of programs like OK to Say, Know the Signs, and social emotional learning methods. We agreed from the beginning that we were going to do everything we could to keep politics out of our efforts. And as we went along, we experienced another horrific shooting down the road at my alma mater. It was clear that we could not leave politics out of any discussion that involved firearms. So we did not address firearms within the context of these bills. What we have done is address those elsewhere, and I've kept up my end of the bargain. And I think it's also important to note that schools in general are one of the safest places that kids can be. They really are, considering the amount of time that they spend there and where we see children's deaths arise and violence occur. Schools aren't the biggest place, but we cannot take that for granted. I think we should also point out that in the last two budgets, we saw agreement with addressing a lot of the issues that we have identified. We approved quite a bit of money in the budget for 21 and 22. In our last budget, we did not play. There was well over $328 million in flexible school safety grants, $952 million for at-risk students, well over $75 million for a variety of before and after school programs, summer school programs, family enrichment centers, and social emotional learning programs. I could go on. I will also note that in the last budget, we were able to secure $2 million for the School Safety and Mental Health Commission. I'd like to thank Chair Weiss for her efforts in that, and for Rep. Meerman, as the commission is one of the things that we will be addressing today. And we have worked with countless stakeholders on policies that we supported, and also we pushed in the budget a lot of the things that we saw were necessary to keep our kids safe. This was not an easy task. During the course of this work, we have we've spoken to families and students at Oxford. We've spoken to parents who lost their first graders in Newtown, Connecticut. We've worked with parents out of Parkland, and we are learning from those horrific incidents to make sure that our kids never have to experience something like this again. We listened to the 911 calls of a terrified teenager in a closet, and you heard the shots, and you heard the screams, and these are things that we will never, ever be able to get out of our heads. We take this work very seriously. And we've also, as we undertook these tasks, discovered there are essentially three different time frames in which we can best protect our students and keep them safe. And the first time period in where I believe we should focus most of our attention and policies is in the area of prevention, promoting overall social wellness, mental health. The second time frame in which we need to look at is, are schools prepared when something happens? It doesn't have to be a school shooting. It could be anything. It could be a fire. It could be a hazardous waste incident. It could be a tornado. We need to make sure that schools do have what they need structurally and the computer technology to keep our kids safe. And then in the event that something happens, the third time frame is recovery. So I do believe that a lot of our work has focused on these different policy areas as well as these three time frames. So last fall, I'd like to now tell you a little bit about my bill. Last fall, there was a report issued from a company that did an independent investigation of Oxford. Out of that information, my bill, the threat assessment bill, was essentially born. This will require all public and charter schools to have a behavior threat assessment and management team. This team must include a school administrator, a mental health professional, and a school resource officer or other law enforcement official. The sub that is forthcoming will also note that law enforcement is not, while we need them to be part of the team, they don't always need to be present. It would depend on the situation and the particular threat assessment at hand. Schools are welcome to add others, but data shows that these three people are the core group best suited to take a holistic approach and identify areas of concern and connect the student or family with resources to address the situation and hopefully prevent a tragedy. The threat assessment team will be responsible for defining prohibited concerning behavior and educating the school community on when someone is at risk for potential harm to themselves or others. It would also teach the community on what and how to report. The threat assessment team would monitor, assess, and perform inquiries into concerning behavior, distinguish between credible and non-credible threats, and determine when a situation requires law enforcement intervention. They would also develop a written plan to assist a student who is engaging in concerning behavior, including supportive measures to address the root of the issue and not just punishment. Threat assessment teams are going to change the lives of our students, positively impact our communities for generations to come. I'm happy to take any questions in particular on my bill. I will also note that we do have some other people that will be coming up after we are done.
And I should have specified in the beginning, we're looking for 30 minutes of testimony and questions. So I'm going to let all members testify to their bills first, and then we'll take questions all together.
Thank you, Chair Colazar, and thank you, Representative Breen, for your partnership on this set of bills and the efforts that you've been putting in over the last month. I really appreciate it. My bill in particular, it deals with the Mental Health Commission, 4089, and for me, this is something that's going to continue to occur outside of us here in the legislature and help us here in the legislature understand more fully what we are facing throughout the school. So it's made up of experts and people that I think can speak into this issue in a lot better way and hopefully take their time to really dig in and evaluate and then give back recommendations to us here in the legislature about things that maybe they see could be changed, and especially help at the school level as well, because this is an ongoing thing, unfortunately, school safety, mental health. So these bills today and the ones to follow aren't the fix that's going to take care of all of this, but I do think these bills get us down the road a lot further than we are today and will be important to helping us maintain our school safety. So my bill in particular, again, is the School Safety Commission. We are looking to have, we currently have a School Safety Commission, as Representative Breen already mentioned, and we want to make sure that that commission isn't pushed aside. That's not the intention of my bill, and so the sub in particular helps to work in those members of the commission and the way that those members are chosen to this new commission, which will make this a commission and statute that can continue to be ongoing, not one that's just in the school education budget. So appreciate any questions if you have any, and thank you for your time.
Good morning. I'd like to thank Chair Colazar and the committee for allowing me to testify on my bill, HB 4092, the H2 version, which was originally policy proposed by on the part of the bipartisan House School Safety Task Force's School Safety Package. Jake Gelsamo, my policy aide, is joining me today for testimony. My bill seeks to codify local notification requirements for the Michigan State Police when they receive a tip related to a K-12 threat. The tip may be relayed as soon as possible or 24 hours and has the flexibility to allow the state police to receive tips, analyze them, and send notifications to the appropriate agencies, as opposed to sending all tips to everyone. Sometimes this includes just law enforcement, a school, CPS, mental health services, counseling services, or oftentimes a combination. While preventing school violence and suicides is a goal, it's important to recognize that the MSP receives a wide variety of tips, some of them very specific, others incredibly vague and general. So the 24-hour deadline gives MSP some time to analyze those vague or general tips. So local law enforcement and or the local sheriff's department are specifically required to be notified when appropriate. I think they are a critical part of preventing the most serious situations that may arise and often may have other knowledge or insights into the tip that the MSP doesn't. The same goes for school districts. The more local the response, the better the outcome will likely be. So I'd like to thank the state police liaisons for continuing to work with me and the school stakeholders as this bill package changes with the goal of making it a bill practical to implement and reflective of the actual response needed given the variety of tips they receive to the OK to Say program in particular. Again, thank you for allowing testimony today. We'd be happy to take questions. And I stopped at some schools this week to read, and they had these on the counter, OK to Say. So it is getting out there, and I do understand when a child sends a tip, it can need some interpretation by the Michigan State Police. Thank you.
Thank you. And do you want to, now, Rep. Breen, do you want to speak to Rep. Puri and Young's bills?
Sure. And I note that, thank you, Rep. DeVore, for her particular bill. MSP has been engaged, and we also are trying to iron out some wrinkles between stakeholders as far as who must be notified and when, ensure that the appropriate tip gets to where it should be. Sometimes the cops need to be involved, sometimes they don't. Sometimes it's a fourth grader just calling to say that another kid was mean to him at lunchtime. So at that point, we do not need the cops involved, but the school should be alerted to any type of bullying so they can address it appropriately. Representative Puri's bill, which is, I believe, 4096, has to do with vernacular. And what we are seeing here, and I believe the people that are going to be testifying after us can give additional insights. When we have an incident at a school, you need every single first responder to be on the same page, not just with each other, because they're coming from different jurisdictions, but also to ensure that they are using the same language that the educators are using. We have a variety of different terms that are often tossed about, and unfortunately, it can lead to confusion. So what we are going to ask MSP to do is to develop the correct terminology to be used in an emergency situation. We are then going to ask MSP to run those terms through the School Safety and Mental Health Commission. There are some things that 6-year-olds probably should not overhear. So we need to make sure that all the vernacular use is not only the same, but developmentally appropriate for any children that would be involved, and also ensure that the educators are on the same page. You can't use certain phrases like clear room without some confusion resulting. So that is what Representative Puri's bill will be doing. Representative Young's bill will be to establish a time frame in which we need school boards and districts to adopt the terminology. We want to give MSP enough time to develop it, run it through, and also make sure that school boards and districts are able to adopt the terminology at the beginning of a school year, not in the middle of it, in order to avoid any confusion.
Thank you. And we started at 9:05, so we'll give it till 9:35 for questions. So with that, thank you all for being here. I'm going to ask a question. So the School Safety Task Force introduced at least a version of these bills last term. They didn't move. Can you talk a little bit more about the work you've done since then?
Certainly. These were introduced, and I won't lie, by the time that they came to us last term, there were multiple bills that I personally was unaware of, but we moved with them anyway, and we started some stakeholder interaction. Since we had a hearing last term, but the bills otherwise did not move, I believe, for something like 6 months maybe. Since then, probably the most important thing we need to know is that the Oxford report came out late last fall. In the interim, we have had an insane amount of input from, I think, every stakeholder under the sun, not just public school groups, but private school groups, charters. We had a portal where we had parents put input. In the most recent weeks, we have had a lot of stakeholders finally begin to respond. Probably the biggest thing, though, was the Oxford report, which caused us to change direction with several of these bills to make sure that we can not repeat some of the same mistakes that happened along that way.
Okay, thank you. Representative Weiss.
Thank you. I have a bunch of questions, but I'm going to limit it to one because I figure like other people probably also have questions. Rep. Meerman, talking about the commission, I know that there is, and you kind of alluded to this, there's already an existing commission under MSP that has does something has similar goals. Can you talk? This is actually kind of a two-part question, some sort of cheating. Can you talk how? And you mentioned a sub, and I don't have the sub that you talked about, so it sounded like you might be combining them in some way. So can you just like explain that part a little bit better? And then also, I know that the commission has already been up and running. Can you also kind of speak to some of the things that they've done and progress that they've made?
Yeah, thank you. So the sub I have kind of takes the way that people are appointed to the commission and by who, and puts it in my bill, because there was some differences between the bill as I introduced it and as what's in the education statute now in the education budget. So that's what my bill's doing. I do have interest in working to see how those two might be combined, and especially possibly have it under the purview of the state police.
I can address that, actually. Sorry, there's better development. So there is one commission that was established after the Parkland shooting under MSP, and then we had 2 budgets ago, one established via boilerplate. That is essentially what we see in Rep. Meerman's bill. However, Michigan Department of Education, after talking to them and MSP, established one, and we are combining the roles. We're actually going to see on the first commission, there were 4 random people appointed. They all do something. For the commission, they bring an area of expertise, but we are going to take a more targeted approach. We are going to be adding somebody that is a specialist in special education. We want to make sure that kids with autism are helped. We want to make sure all of our kids are helped. And we're going to make sure that a building administrator is there, as they will be carrying out a lot of the functions. But most importantly, what we have now finally is agreement from everybody, under one commission, under one umbrella, one department, with the same function, so they can continue the work. And Jason Russell, who will be testifying later, has been seated on the commission, and he can tell you about some of the things they've been working on.
We did have Breen and I met with them about 8 months ago, and we talked to them maybe longer, about this time last year, a year ago.
Okay. Thank you. Vice Chair Green.
I'm going to shift my question now because I'm a little bit confused because I'm looking online and you have the Michigan State Police, the Office of the School Safety, and then you had the other one that was established in boilerplate, the School Safety and Mental Health Commission, which is led by Dr. Colbert. And then that has a whole team of people, like of leading experts, like in Dr. Lay, the school threat assessments, Dr. Malas, who works for U of M, an expert in inpatient under age 18. You have Mr. Russell is also on that current commission. You have a school psychologist, psychiatrist, Dr. Jennifer T. I'm not going to mess her name up, but I'm looking at all these experts. So what is happening to them if you combine, because this was originally under the Michigan Department of Education, and granted I haven't read if it's in the sub. I'm just looking for clarification because you had this School Safety and Mental Health Commission, and then you had the Office of School Safety with the MSP, which also then trained police officers with the SROs. So is that what's going to be combined?
So the School Safety and Mental Health Commission, which is the broader spectrum, like all across the board, addressing all areas of school and safety, mental health, physical well-being, that is going to be under MSP. There are some people who sit on both commissions. What we are trying to do is ensure that, for the most part, the people that are on the second commission
What are you calling the second commission?
The second commission is the one that is here at hand.
But the school safety one?
Right now, it was under the purview of MDE.
Okay. Led by Dr. Colbert.
Yes. We are going to be shifting that over to MSP.
Okay.
And so those areas of expertise are not going to be lost. In fact, we want to make sure that there's continuity, again, because there are people that sit on both. Some of those people are going to be continuing on the work there.
That's what I was just going to ask. Will you keep those? Because
Yes,
I'm looking at, we have leading experts nationwide on
Yes,
that
we
commission.
do, which is why we want to keep them.
Okay. Thank you.
Thank you. Representative Wagella.
Hi. First off, thank you for coming here today. I think this is a sometimes complicated conversation, and I think starting is really important. But I do want to just, for a second, I think when we talk about this, we need to really be careful how we frame it, because I see school safety and like the physical barrier of a school as completely different from mental health. And I say that because schools right now are one of the safest places for kids to be. That's what statistics show. I understand, I keep saying that, and people on this committee have heard me say that like a million times. But I say that because the school safety industry is now a $3.1 billion industry, which is more than the standardized testing industry. I think that's an important part of discussion. That being said, in regards to House Bill 4089, I was looking at the House Fiscal, and I understand there's a sub, but I noticed that on the School Safety and Mental Health Commission that there was not a majority of mental health professionals on that, and I was wondering if under the sub there would be a majority of mental health professionals. And then this kind of a two-part is I saw that there was a prosecutor on the commission. I just was curious as to why that was.
I'd recommended that we not use the prosecutor position, and I believe that there is definitely a good balance of mental health professionals on there. Meerman, did you want to add?
I just wanted to, I guess, agree with you, Wegela, that I think there has been a lot of focus on how do we secure the buildings, when in fact the way that we can help a kid from even considering it is to try to get that mental health first. And so I do think that focus on the mental health side of things has been left behind in many discussions and should come forward in a much more robust way than we have seen it before.
Some of these roles also do overlap. Like we have people who are experts in threat assessments that are both mental health experts, but they can also be security experts as well. At least they have experience in both those areas. We have what we are looking at is adding somebody who's not just overall school mental well-being, but then we have people who are more targeted, kids who are at the top of the MTSS pyramid, if you will. So as a parent of a kid who has an IEP, I know that you have to tailor different approaches school-wide, and you have to also make sure that kids are at the top of the pyramid who are most susceptible and vulnerable to either hurting themselves or others, that they need a more targeted approach. So I do believe that the new commission will be able to embrace all aspects of that.
Sorry, just a brief follow-up, but that's okay. Just has there been consideration of like separating the two conversations, school safety as a commission and then mental health as something separate? Because like I guess my concern is they're different discussions, and I'm not sure that I at least personally see it as like them being together. I don't know if I'm making sense, but the way that I'm looking at it is having those in separate discussions, right? How do we keep schools safe from horrific acts of violence, and how do we keep kids in schools mental health top notch?
I would argue that you keep kids safe from violence in both aspects. You want to obviously prevent violence overall, and I did say at the beginning of my testimony, I agree with you. Schools are one of the safest places kids can be. But in order to protect kids from violence, some of those kids are committing acts of violence. So you do have to take it both ways. I don't think it's a separate discussion. I think they should be one and the same. You're going to go down one path when you talk about school hardening, but also when you talk about other things such as processes for admitting visitors, processes for threat assessments. And I think threat assessments, that's one of the things that will embrace both of these features, both talking about mental health and also making sure that kids can be physically secure. And you might see in here, we're looking at having somebody who is an expert in inpatient adolescents, kids who really need that targeted approach. How are we going to help them reintegrate into the public school system or the private school system? So I think that by putting all these people in the room together, we're going to get some good recommendations, because let's face it, most of us here in the legislature, we are not experts, although some people might think they are, in every single field about everything everywhere. That's not the case. Here we're putting all the people who are experts in education, in mental well-being, and physical security in one room, and hopefully what we will see are recommended approaches, and the legislature can take the lead from there.
Okay, thank you. We do have 3 additional members that want to ask questions. I'm going to give an additional 5 minutes, but I ask that we try to keep it timely just because we do have several people who did travel to testify. So I want to make sure we get to them as well. But I want to get these three members the opportunity to get their questions answered. So Representative Glanville.
Thank you, and thank you all for the work that you've done on this. It is a very complex process, and as we can see from the subs we have pending and before us today, it continues to be a work in progress. I want to kind of echo what you're saying here. I would agree that mental health and school hardening go hand in hand. I always say, you know, a safe school is a school a student doesn't need to be rescued from. And so how do we get there? We need to look outside the schools at what is influencing the behaviors and the culture inside the schools. And that is mental health, right? And the supports that our kids have and our families have as well. So I appreciate this bilateral approach. And even when we talk about school hardening, you know, the mental weight that can put on kids when they see, security measures put into place, it may offer them comfort, it may offer them concern. So even understanding how what seems like, a positive step forward in hardening our schools, you know, how that impacts our kids is a big part of this as well. So, but I'll get to my question. Primarily, I want to understand a little bit more about the behavioral threat assessment team and how that interacts specifically with the OK to Say piece, and then also with the Mental Health Commission. So my thinking is, OK to Say, it's been around since 2010 or even earlier. You know, I've been working with schools and kids to raise awareness around that, and we used it, it was pretty prolific in my schools where I worked. And I know that those reports come back to the school. And so again, just wrapping in that threat assessment team who, and to your point that it might not be a 24-hour response necessary if a fourth grader is concerned about, a kid at lunch, do we need to, they report that on Saturday, do we need to call the superintendent on Sunday to report that, or could it be a slightly longer window, and that sort of thing. So around the urgency of particular reports. And like I said, and then also just how that team interacts with these different commissions and things that are coming forward.
To jump in and answer the 24-hour, if I could, real quick, be very quick. In my mind, it's more important to get the information to the locals because they understand the issue better. And so there is some vetting that goes on at the MSP with OK to Say, but let's get it to the locals and let them see the situation first, too.
Right. As far as the threat assessment team and tips, I think logistically it should flow pretty smoothly. The most important, the tip needs to get to usually the building principal. And so that administrator will be able to probably rapidly assess what is going on. And you look confused.
Well, I just wanted to mention in a larger urban district, it might be more appropriate for that tip, and it typically goes to their security professional first and then gets filtered down that way.
I think it's going to depend on the tip.
Definitely gets, right, and it definitely gets to the building leadership, but like I said, that's where I'm thinking, how does this team all interact?
So if there is a viable tip that a student is about to harm him or herself or others, the threat assessment team would be able to rapidly convene to put together a plan and resources. And I personally, I don't like the term threat assessment. It seems scary, but it is the most common term that is used because, again, a kid is more often a threat to him or herself than they are to other people. So I feel confident that administrators and local law enforcement will be able to determine if it's something that needs to be addressed by law enforcement versus school personnel. It seems to just currently organically work fairly well, but the goal is to make sure more so with threat assessments that we have a low threshold for administering them so that it's not going to take a lot in order for an assessment to be done. You want to get those kids quickly. You want to determine what they need quickly and address any arising issues before they blossom into something bigger.
Okay,
Thank you.
Thank you. Representative Paquette.
Thank you, Mr. Chair. I'd say I appreciate the testimony here, but I'd say a healthy school culture is the most important aspect of learning. Kids feeling safe in their environment as well. All boils down to, I think, a healthy school culture. But sometimes people making decisions or recommendations on how to carry out, how to carry on your day in a unique school, it's sometimes detrimental to school culture from what I've seen. So I've got two quick questions. The first one would be, how does this package of bills, keep the culture of each school in mind? And then two, could you give me an example of how you might foresee this commission, recommending something and then breaking down what that actually means to any of my schools?
On the commission side, we're asking for reports back from them to us here in the legislature. So I would hope that, those reports would include recommendations of possible statute changes or places where they see more funding is needed. And then quickly on the culture side of things, I agree, Rep. Paquette, that it is paramount in how things work inside the school and how well things happen. So I'm not sure that we can sort of make that culture better, but I agree that it is the first thing we should be looking at.
I would note also that the school safety and mental health grants, which are flexible, and we had, I think, about 324 million of them in the last budget. Schools are different, every culture is different, and schools will be able to access those funds in order to help implement certain programs that would help them address culture. I know, just as an example, Novi schools, for a while, they had the Leader in Me program. That's like the 7 healthy habits for kids. My kids would come home, sing songs about filling their buckets and putting first things first. So developing appropriate school culture and making sure that multi-tiered systems of support are in place I believe, are probably best addressed in a lot of these budget items that we just passed. Schools will be able to access a lot of those funds and get the resources and support they need, because there's certain things we can't legislate. We can't legislate good parenting. We can't legislate social emotional learning, but what we can do is give schools the resources and tools they need in order to implement what's best for their district.
Okay, thank you. Representative Johnson.
Thank you, Chair Kolazar. Thank you so much for your thoughtfulness on this and all the time and energy and work that's gone into it. Representative Glanville brought up a really good point, that the external factors of the cultural problems are in our schools, but they originate outside of our schools. So I guess I'm a little confused why we don't have in the commission, or at least the discussion, our civic groups outside the schools, namely churches, synagogues, mosques, religious groups that are already doing parenting counseling, marriage counseling, family counseling, and they're working on so much of the cultural problems that we're facing. Could we have a partnership and kind of work with them as well to reinforce that the community unifying effort to really solidify healthier families so that the kids can learn?
The commission is going to focus on statewide solutions, and what I would also say is, again, in the budget, there was a ton of money thrown at local community partners that already do work with our districts, like Goal Line Detroit. They do social emotional learning programs, youth enrichment activities, and they involve the family. I believe $14 million was given to the My Families Exchange, which is a holistic approach, which does work with other community partners, whether they're religious or not. They look at the whole family and the educator and the learner in order to help ensure that kids can learn and that kids can be safe. So as far as putting a specific religious organization on the commission, I don't think that would be appropriate. What I do believe is that we have enough people that know enough about other local organizations and what they're doing in order to help direct some of these policies and procedures. But I don't think putting a specific organization on the commission has been discussed. I'm always open to something like that, but I don't think a specific organization in particular would necessarily do anything better than what we're doing within the budget to give these partnerships and school money to, give districts money to work with these outside organizations.
And I'm not suggesting one specific organization, but just the discussion around it. Dearborn's not the Upper Peninsula, and Garden City is not Grand Rapids, but they all have their own cultures, and the civic community religious organizations in those areas, I would think it would be good to encourage this discussion. They all know their cultural situations. They're already counseling.
I do believe that is happening at the local level. I can't think of a single school district that would not be partnering with other local organizations to better benefit their kids.
Okay, thank you. We do have several people still wishing to testify, so I want to thank all members for coming in today and testifying. And Reps Breen and Meerman, I know we've met multiple times about your bills as well as the bills of the task force. I just want to thank you both for all of your work that you have done over the last year. Thank you.
Chair, with your permission, as you called the other witnesses, may I stay up here with them in case there are additional questions to
Yes.
field? Thank you.
And with that, next up, we do have a representative from Michigan State Police. I believe it could perhaps be Travis Fletcher. I didn't have a name given to me, so.
I see him back there.
No? Okay, we don't.
No, I will say I've spoken with Sergeant Fletcher multiple times, and he has been a great asset, but I believe he's waiting on the final drafts before weighing in.
Okay, that makes sense. All right, then next up, we have Melissa Cree, a psychologist from Oxford, a school psychologist from Oxford.
Could you possibly call up all three at the same time? If not, that's fine.
Let's just start with.
Okay. Hi. Thank you, Mr. Chair and members of the House Education Committee, for the opportunity to speak on behalf of the Michigan Association of School Psychologists on these important bills. I'm so excited to be here. My name is Melissa Cree. I'm a school psychologist in Oxford, where I've been for almost 12 years. I've worked at the preschool through high school levels, currently also serving on district level committees surrounding mental health, social emotional learning, and threat assessment. The scope of my work and ultimately my career changed significantly after November 30th, 2021, and the devastating loss of 4 of our students. In the aftermath, I considered changing districts, changing careers, had long conversations with colleagues and my husband and what to do next. Ultimately, I made a commitment and conscious decision to remain in Oxford and to continue to raise my young children there. My own kids will attend Oxford High School. November 30th will always be a part of their school experience. It is both my professional and personal obligation to ensure that their and every other student's physical and emotional safety are considered in the work that we do surrounding school safety, suicide, and threat assessment. In large part, I chose to stay living and working in Oxford because I felt that I could be a support and use my professional skills and experience to be a part of our district's work moving forward. It's been a very, very long road that continues to divide our community. The commitment to Oxford students and staff, along with the drive to support other districts and use my experience to advocate for change, led me to join the mental health subcommittee in the Michigan Association of School Psychologists, and ultimately, me having the incredible opportunity to speak to you today in support of these bills. Bills that have the potential to save lives, to give districts guidance surrounding threat assessment work that many have been desperately seeking and trying to initiate in their own districts following Oxford and other school tragedies. Oxford crisis teams had the privilege of being trained in behavior threat assessment and management by Dr. Melissa Reeves. This is the first step. The district choosing a threat assessment model and facilitating a wide-scale training of multidisciplinary teams across the district. It needs to be a priority for it to work. There are a lot of initiatives at play in the state of education. It has to be prioritized. The next step is to put that training into action and continuously improve our work. I work very closely with our Director of Safety and Security, and I am so fortunate that she sees the importance of incorporating mental health staff into district-level conversations surrounding this work. For mental health staff to have input into policies that may have historically been administrative and law enforcement-led has allowed additional considerations, both physical and psychological safety, to be implemented with daily policies and procedures. They're impossible to separate. As of this school year, following this district level training, we now have threat assessment BTAM teams in every school building that meet monthly. This is a huge undertaking. There's a lot of things going on in the schools. Some have asked why every building needs their own meeting every month. The reason is that we know our kids. We know the culture and in and outs of the kids and the staff in our buildings. We know which kids, what they might have going on at home. We know which kids may have had a recent loss in their own family. We know which teachers may have been parents of an Oxford High School student that will need additional support on hard days too. It also gives us the unique opportunity to debrief and problem solve through our own situations and experiences at our building level. It allows the conversations in these meetings to lead to much more productive collaboration and immediately useful strategies and suggestions. In addition to debriefing, this is also where we are trained regularly on crisis response policies, participate in tabletop exercises to identify any areas of need, anything we're missing for next time, and to communicate any important updates to staff. These meetings are a priority for our teams. It is there that we're able to do the proactive and preventative work, so that if and when we are called into action, we are ready to respond in an effective and student-focused way. In regards to threat assessment, our building level BTAM teams require a minimum of a school administrator, a master's level mental health professional, and a school resource officer, every time, at minimum. More staff are brought on depending on the situation and if needed. These teams are called upon, I'm at currently at the elementary level. We're doing these types of assessments at least weekly, if not more than weekly. I would say at secondary, they're occurring daily. Having a mental health professional on every threat assessment and crisis response in a building is not without its challenges. As many as you know, this is a field with a critical shortage in staffing and student mental health and behavior needs getting higher by the day. I'm so appreciative of legislation that's been passed to budget for additional mental health staff in schools, and to acknowledge the importance of the mental health consideration in the event of a crisis or threat. Once safety is ensured, once physical safety is ensured, we are then able to take the next steps to connect the students and family with psychological safety, mental health and community resources, plans of reentry, and to develop a support plan moving forward both in the schools and community. When administration, mental health, and SROs can work together in a response, we can ensure that both psychological, or physical and emotional safety are prioritized in the actions taken to respond to our students and community. Having common and consistent training and language allows us to support other buildings within our own district and even other neighboring districts should a larger scale event occur when additional support is needed. Many surrounding districts supported us in the weeks and months after November 30th, especially in the significant mental health needs of our students and staff. And with bills such as the one today, a community of mutual aid could more seamlessly come together to deploy support following a crisis event. This work cannot be ignored. It has become almost cliche to say it's not a matter of if but when a school will experience a crisis. Threat assessment and crisis teams in Michigan are called to action not once in a while, not annually, not maybe, but daily. I promise you, every single day, across districts, counties, and the state. The bills before you today have the potential to equip schools with the best practice models and policies so that our students, staff, and families can feel confident in their district's ability to conduct threat assessments and follow school safety protocols in a way that prioritizes both their physical and psychological safety. I'm so appreciative of your consideration.
Thank you. And being a school psychologist is often, I'm sure, very thankless work. So, and we know we don't have enough school psychologists in the state, as we heard last week. So I just want to thank you for everything you do. It is recognized, it is appreciated, and just we are all deeply grateful for everything you're doing. And with that, we have a question from Representative Churches.
Thank you. I think my question is more for Representative Breen in regards to MSP involvement. So I also kind of want to echo what Representative Wagella mentioned. I'm curious about the differentiation between crisis response and preventative response. And these bills seem to be heavily focused on crisis response, and we won't fix the problem unless we are also heavily focused on preventative responses, such as like conflict resolution, restorative practices, anti-bullying, gang intervention, and none of those things were mentioned in the bills. And I think that should be something that maybe we could talk about and consider. So I did a little bit of reading on this. I've been on a crisis intervention team. I have most threats to kill happen at the elementary level, and I think because these minds are not fully developed yet, and there's various reasons for these things to happen, not necessarily that there is a dangerous threat. And I have been present when law enforcement has intervened with a child, and I can tell you that I wish that there were more preventative strategies before that occurred. And I don't know if this is ensuring that we do that. And I did some reading over the weekend, and just trying to have conversations to grow help me with my questions. So I think my question for MSP is, it seems like MSP's model is based off of the NTAC model, the Secret Services National Threat Assessment Center, which is not a model, it's a toolkit. And it is good to have something to start with. And I think having a crisis response team is really important. But there are other models. So I was according to a recent scientific research of threat assessment research, it's not the only model, and there are research-based practices that are making sure that we're not singling out kids with emotional impairments or other factors that they could be treated in a different way. So I'm worried about if schools are utilizing the NTAC model and they aren't aware of other models that are research-based to help kids, because when we have crisis response, we have it here at the Capitol, we have it at the airport when you go through TSA, and we have it at schools. If we're doing the same crisis response as somewhere else, it needs to be different when it's for kids. So I'm looking for how is it going to be different, and is this at all going to impact local control of schools utilizing models that, I don't know, is it going to narrowly take away local control by mandating the use of a specific model? Because I want to make sure that crisis teams in schools, which are very important, have the autonomy to develop things, because in education you have to move quickly and you have to adapt and change to make sure you're using research-based practices that are student-focused, student-led, instead of crisis-focused. So I don't know if you can answer those questions.
I'm going to start and then kick it to Melissa. I'll say that I do agree with you. And you heard me talk about the different time frames that we have to address an issue. 1 is prevention, 2 is how do you respond in the moment, and 3 is how do you recover. And yes, we want the bulk of resources to come in with prevention, but we can't ignore the other 2 time frames. So I would say this is not an either or, this is a yes and. So, and talking about restorative justice and a lot of the things that you practice, those are delivered at the district level. This does not, in my opinion, take away local control. We did have intense discussions with a lot of the school stakeholder groups. We said there are these different models, and we were going to give them an option of choosing. And what we heard was, just pick one, so that we can have certain unified, they can have certain unified standards, which is something that we don't like to necessarily legislate, but sometimes we do need a unified response, such as with the vernacular that we're using, the terminology, the critical mapping. But I would say that what you are talking about, I think, is a yes and I agree with you. But we also have somebody that will testify and can offer, in the short time that we have left, offer additional information on that. But if Melissa has anything to add.
Just a little. I agree with you too. They're kids. And in the work that we've done in Oxford, as we've been kind of improving and fleshing out a lot of these policies, having people, right now I speak for elementary when I attend the district level meetings, because even though when you think of a lot of this, your head goes to secondary, a lot of it can also be young kids making statements out of frustration that we need to address. So always considering developmental age and maturity, and even the suicide assessment that we adopted, it's similar, the model at both but they're different questions for elementary kids. With that in mind, just the importance of that, and then having the mental health person be on those teams can also then support students respond to being in those types of assessments in different ways. Some are just immediately crying, they think they're in trouble, and working with the student in that way. And then when we're calling parents in to be with them and work through and reiterating that we're learning from this and that we're here to support you and we're here because our job is to keep you safe, is a big part of the work that we do while we're doing this.
Okay. Thank you so much for being here. Next up, we're going to bring up two people. We have Jason Russell and Karen Dunhalter. I hope I said that name right. Is it Dunhalter? Yes. Oh, wonderful.
Good morning. Thank you, Mr. Chair and members of the House Education Committee for giving me this opportunity to speak this morning. I'm a firm believer in school safety is everyone's responsibility. So I appreciate that you are talking about these bills regarding school safety. The days have gone, as we've said, where this isn't going to happen in my school. It's when is it going to happen and how are we going to be prepared for this to happen? So I feel, especially with Oxford, this is our time to dig in and prepare and prevent tragedies happening in our state. So my name is Karen Dunhalter. I'm a school social worker for 26 years. I'm currently in the high school level in Southgate Community Schools. However, I've had the opportunity to serve K through 12 alternative education too. And I'm also the president of the Michigan Association of School Social Workers, Region A, and our region includes Washtenaw, Wayne, and Monroe County. In this association, we often have these conversations amongst the social workers across the counties. I'm also able to be in the state level meetings. So these are also conversations that we are having. So every single bill that has been presented today is on target for the things that we are talking about across the counties, across the state as school social workers. I had the luxury years ago in my district to be highly trained for crisis intervention. We had received a grant to work with 3 districts to highly train with law enforcement, fire, and school staff. I was afforded the training with the FBI, FEMA. We did SIMS, which is Crisis Stress Management. And we also had the training of the Trauma and Loss Institute, which certified school employees. And then from there, we developed a regional crisis team. So there was a regional level that could respond to other schools if there was a crisis. So I was often called out to respond to other school tragedies. Little did I know that in our own district, we would face a major tragedy. I was a first responder to a student who committed suicide during the school day in the school bathroom. Never in all my years as a school social worker did I think that this would be my role. Again, thank you to the immense amount of training that I was able to have, and through that prior grant, I was able to be a CPR and first aid trainer for all our teachers and cycling through the 2-year certification. Little did I know I would need to use that expertise on that day. I cannot say enough, the constant training that we had went through helped me in that situation. If anyone has been in a crisis situation, you know your logical brain goes offline and you cannot access your logical brain. But if you are highly trained, it becomes a muscle memory. Again, little did I know as a school social worker, I would be trying to apply life-saving measures to a student who I'd known since kindergarten. I was able to help in the situation in the restroom. Then I was able, again, through my training, help assist with 400 students that needed to be released to a parent that was on their emergency card within a short span of time. Then again, with my training, I was able to help 3 of his friends who he had told before first hour and didn't believe him. I then was able to help with the crisis team in our district, and along with members of MASSW from other schools that came to help us in the aftermath of helping all our students and staff that were in crisis. I was involved in identifying the students that were suicidal and needed immediate attention. Again, a tragedy like this is nothing you ever prepare for, and it goes on for years. This was 10 years ago, and we still are impacted by that, our staff, our students. So again, all of my training, which I am so lucky to have had, has helped me in this crisis. So again, talking about implementing trainings, giving the ability for schools to train, giving the funding for it is so necessary. So again, I'm very passionate about school safety because of all of this, and in recognizing that we are all working in silos regarding school safety. So districts are working on their own, or even buildings are different levels of training than other buildings. How can we all come together and help each other? Because school safety is everyone's responsibility. So in my work with the Michigan Association of School Social Workers and talking with social workers who are experiencing the same difficulties in their own district, I had an idea and created, along with some of these social workers, a school safety task force. It is 18 downriver communities with law enforcement, fire, superintendents, social workers, community members, such as pastors. We have a hospital from the trauma ER involved, and we are all working together as a team on these exact issues that you guys are presenting today. We are working on trying to come up with a common language, and we had heard that the Michigan State Police was going to work on that, so we've kind of tabled that, but we were saying all of these cities are going to be responding as a mutual aid agreement to a school that they have no idea or have been to. So how can we have a common terminology? How can we train together? How can we share resources? How can we share best practices so everyone is able to respond in the best way possible? So again, it's been amazing. We have police chiefs, fire chiefs, superintendents, everyone coming together and sharing their knowledge and expertise to make our schools safer and better, and offering so many resources. And again, this has branched out even further. We have partnered with Monroe County. We have partnered with Iowa. We've partnered with Utah. The west side of the state is also trying to do this, because every single one of these bills are in these discussions amongst all these different entities. So I'm, again, so happy to be here today to share and back up what you guys are doing, the work that you're doing, because in all of these circles, not even just in the state of Michigan, these are the concerns that are brought forth on the table. So with our school task force, we had to break it down to 3 categories to try and work on, and one is threat assessments. One is prevention. One is facilities, safety, and security. And so we are broken up into 3 subgroups to try and work on those exact issues across 18 cities, so we can better be prepared and help our students. So I'm in full support of all of these bills. The only thing that I ask is to think about building the capacity and flexibility for the educational staff, because we are given so much more responsibility than when I first started in my career 26 years ago. The level of needs of our students, especially post-pandemic, have dramatically increased. We are in a mental health crisis, along with all the other responsibilities of our job. Trying to make sure that we attend to all these things has been difficult. So we all agree across all these entities that this is important. People want to be trained. People want to know what the best practice is, and people want to know what to do in this situation. It's just being able to be given the time, the skills, the training. We want policies and procedures, so we are not doing something that we don't know might be harmful. So I appreciate, again, this opportunity, and hopefully we can get some of these things implemented and started across our districts.
Thank you so much. And much like I said to Ms. Cree, thank you for all you do as well. We don't have enough school social workers either, and it's often a thankless job. So thank you.
Thank you.
We do have one question from Vice Chair Green.
Thank you. Thank you, Mr. Chair. Yes, thank you so much for your service as a kid who went to Henry Ford High School in the 90s. I don't know if you remember that time era. There was a name for it, so I appreciate everything that you do. Just trying to unpack some of the stuff that you talked about. So how did you develop your school's emergency operation plan? Did you do that as a team? Just some follow-up questions when you answer it, like how often do you review it? Do you coordinate that with your ISD as well?
So we have the Michigan State Emergency Operation Plan, and when we first received it about 6 years ago, and maybe a little bit more, I was on the initial team where we reviewed the whole plan from start to finish and then tailored the parts that you're supposed to your district. And then we rolled it out to our staff, and then we had building level crisis teams, and then we have a district level. So the district level then helps the building level keep up to date, meets together as a team to help roll things out to staff to make sure you're doing trainings. At the ISD at the time wasn't really involved, but we have a brand new position now at our ISD of school safety and security with a retired police officer. So we're really hoping to be able to come together as a region and help each other again. And he has joined our school safety task force in the downriver area to get ideas on how to better help the regional area.
Awesome. And how often do you review your plan then?
So we try and do it yearly and look at, because again, there's so many changing parts. Mm-hmm. There's new policies and procedures, new best practices. So
thank you. Thank you
problem.
So much. I appreciate that.
Okay, thank you. Representative Johnson.
Thank you, Chair. I really like the whole package. I just want you to know, and I can't speak for everyone here, but when all our comments, all our questions, I think, are just adding more, and it's both and, like Representative Breen said. One of my superintendents asked me, though, if we could encourage the conversation with the commission, or one of them, I guess they're combined now, to make sure there's a disciplinary action part for those who call in false threats, because he had 3 in 1 week, shut down the school 3 times in 1 week, and this is so disruptive to learning, obviously, so for that to be considered in the conversations. Thanks.
Okay, thank you. And Mr. Russell, we'll turn it over to you.
Thank you, Mr. Chair. Thank you, members of the committee. I'll be brief. I think a lot of things have been said. My name is Jason Russell. I'm a current member of the School Safety and Mental Health Commission. I'm also a school safety consultant, a former Secret Service agent, and a parent of a teacher and 2 public school children. I'm fully in support of the legislation, and I wanted to address a couple quick elements. There was some conversation regarding the makeup of the current School Safety and Mental Health Commission. I believe, Representative, you that commission is actually made up majority of mental health people. I'm actually the only security person on that commission. The majority of what we do on that commission is really work on developing pipelines for mental health professionals for schools, because we see that there's such a need for that. So the majority of our conversations have been around the mental health side of better preparing schools. So I think that's something I wanted to point out. And I think the work of that commission is really just beginning. So I'm encouraged that this bill will hopefully continue that and maybe bring some additional expertise onto that commission. The behavioral threat assessment bill, I think is, to me, a necessary. The one thing I think that's extremely important to recognize about behavioral threat assessment is it's not just training people how to identify threats. The vast majority of what behavioral threat assessment really is intervention strategies to get a kid off the path to violence. So I think the thing that really particularly stands out in this bill is it's very prescriptive. What on my safety consulting side, I work with the majority of the school districts in Michigan as well as school districts across the country. And what Michigan is doing, truthfully, in terms of school safety, we're far ahead of other states in some of the steps that we've taken, and especially in the last 2 to 3 years. So I think it's continuing on this path. The behavioral threat assessment piece, behavioral threat assessment truly is the truest path to prevention. And I think as we look at ways to devote school and safety resources, I think the more money we can devote and the more resources we can devote toward prevention and identifying kids that are exhibiting behaviors of concern, especially with the idea that intervention strategy should be very therapeutic and not punitive. We want to get kids off that path to violence. The other bill, I think, is the common terminology bill, to me, long overdue. We assess, as I said, the majority of the public school districts in Michigan, and a consistent finding that we see in our assessments is just language all over the map in terms of emergency response, even within a district. Actually, even within a single school, people using language interchangeably. So I think going to a consistent language will do a lot to really improve communication so that as schools are responding to emergencies, their communication will be more efficient because they're all using the same words. One of the maybe small details, but I think it's important to note, is when I do assessments, one of the biggest gaps that I find is substitute teachers. And substitute teachers are all over different districts, and if they're using 10 different emergency plans in 10 different districts, they're not going to have any idea how to respond. So I think this common language bill, to me, will go a long way to just better preparing schools, improving communication, and in many ways encourage law enforcement to come on board in terms of the language and the words that they use so that they're not used interchangeably. So appreciate the time. Certainly happy to answer any questions, but appreciate the time to allow me to testify.
Yeah, thank you for your testimony and for your work on the commission. I have a question. Can you talk a little bit about how Michigan is doing compared to other states in terms of addressing school safety, budget dollars, et cetera? Like, how are we doing in comparison to other states?
You know, I'm from Michigan, but we do work across the country. I think what Michigan has done well is we followed a process. And, you know, I'm a big fan of assessments, which is really diagnosing what your issues are before you solve the issues. It's like going to the doctor before you go to the pharmacy. The one thing that Michigan has done that no other state has done is allowed for schools to actually have an assessment done to see what their weaknesses are. That's put us so far ahead of other states in terms of when schools are taking those resources and they're deciding what's important based on their culture and their climate and the type of environment that they want, that they now know what their weaknesses are so they can really guide those resources more pointedly at their issues as opposed to just guessing and buying whatever they think might work. So I think that truthfully has been probably the biggest thing that we've seen that Michigan has done differently, is really start with a process, allow schools to be diagnosed so that they can solve these appropriately. And then I think the focus on mental health. You know, some of the states that I go to, we can't even have the conversation. And I think Michigan has done a good job of understanding that it all starts with mental health. It all starts with taking care of these kids and creating these positive school climates. And I think Michigan has done a really good job of identifying that and devoting resources to that.
Thank you very much. Thank you both for being here. And we do have one more person wishing to testify. We have Ashley Dupe. It says representing self. So, Ms. Dupe, you can come on up. Thank you very much. And also, just so committee members are aware, we have about 12 minutes left, and we do have members that do have to go to another committee at 10:30. So just don't want to catch you off guard.
Chair Colzar, Vice Chair Churches, Minority Vice Chair Green, thank you for allowing me to testify this morning to House Bills 4089, 4092, 4095, 4096, and 5549. My name is Ashley Dopp, and I am a school social worker who has worked in elementary to high school settings, supporting general education, special education students, and working in center-based programs. Throughout the years, I've encountered a variety of situations in supporting students, school staff, and families navigate situations where the physical, mental health, and overall being of individuals were at risk. I can tell you that the resources, staffing, support, infrastructure, and processes and policies of each district that I worked for varied greatly. Some districts have well-established behavior threat assessment teams, pulling resources from multiple districts to support and assess situations with clearly defined processes and terminology, and others portraying risk assessment processes that were informal, miscommunicated, and difficult to complete in a thorough and timely manner, given juggling the numerous responsibilities with low administrative mental health staffing ratios compared to the large student populations. I have worked in buildings where I was the sole mental health professional servicing 471 students, whereas the National Association of Social Workers recommends a ratio of 1 to 250 students. Imagine being able to balance all the needs of a school mental health for staff, professionals, and students while doing behavioral threat assessments that require such intense focus. The bill presented before you today begins to provide guidance and structure to support our educators in their ability to ensure a safe environment in which to learn and work. In my previous employment as a school social worker, I encountered an active mental health emergency in which a known adult having a mental health emergency entered the building. Through my social work training, I assisted in connecting this individual with emergency mental health supports in the community. I encountered many obstacles given the lack of cohesion support between local police forces and community mental health entities in the region. After the incident, I received intimidation and retribution for the actions that I took in attempts to distract from issues that were occurring in that school system. I responded ethically given my social work training and attempted to highlight the lack of formal training in the district had provided the staff, as well as limitation and threat response policies that the district had at that time. I advocated for the district to take initiative to analyze and learn from the situation and others like it in order to review and create new policies and processes to respond to emergency situations, only to be stifled. I watched myself and colleagues consistently report safety concerns regarding infrastructure of the building, lack of staffing to be able to handle and monitor at-risk students, and other concerns, only to express issues being swept under the rug, with a lack of timely, actionable solutions that were thoroughly communicated to staff. Despite my best efforts, I found myself burnt out advocating for this change within that system. Experiencing a traumatic event with a lack of making meaning from it and ultimately left the public school setting. I believe that the school safety bill package will begin to bring much needed oversight and guidance to school districts in Michigan to have clearly defined behavioral threat assessment processes and teams, standardized terminology and reporting processes, along with a commission to continuously work on and look at improvements needed in supporting the mental health and safety of our children, educators, and families. I hope that by sharing my experience today, it will shed a light as another voice to testify the importance of this safety bill package before you today. Thank you for allowing me to testify.
Thank you, and apologies for the mispronunciation of your name when you came up. Thank you, Ms. Dopp. Appreciate it. We do have several cards here, so I'm gonna, and some are on all bills, some are on certain bills, so bear with me. Not wishing to speak and supporting all bills in concept, Bob Kefjan from Michigan Association of Secondary School Principals. Not wishing to speak, supporting all 5 bills, Paul Stankiewicz from the Michigan Catholic Conference. Not wishing to speak, supporting all the bills, Jen Garland, Michigan PTA, not wishing to speak, supporting all of the bills. Mary Pollock from the American Association of University Women of Michigan, not wishing to speak, supporting bills 4089, 4092, 4095, 4096, David Randall's Oakland Schools, not wishing to speak and supporting House Bills 4089, 4092, 4095, 4096, Mike Latvis, Wayne Risa, and not wishing to speak, supporting 4089, 4092, 4095, 4096, Brian Broderick, Michigan Association of Non-Public Schools, not wishing to speak and neutral on 4089, 4095, 4096, and 5549, Matt Saxton from Michigan Sheriff's Association, and not wishing to speak and supporting House Bill 4092, Matt Saxton from Michigan Sheriff Association. And Vice Chair Green moves to excuse absent members without objection. Absent members are excused, and there being no further business before the committee will stand adjourned. Thank you.